Picture this. You're at a concert, music's loud, everyone's going crazy, and then someone just collapses right there. You go over, and they're not breathing. They're unconscious. What would you even do? It's like every second just drags on forever. That's what a medical emergency is like, and today we're going to talk about what you can do. We're diving deep, deep into emergency medicine when those split-second decisions can be life or death. But first, a big thank you to London HeartbeatsZ Academy over the UK. They put together all this incredible material that we're going over today, this deep dive. They're doing great stuff, so make sure you check them out. Facebook, Instagram, Spotify, YouTube, they're everywhere. All right, so let's jump right in. Ever heard of the golden hour? Sounds like a movie, right? But in the ER, it's totally different.
Yeah, it's super serious. So the golden hour is that first hour after like a bad injury or some kind of medical crisis. It's that window where getting the right treatment makes the biggest difference. Think of it like a fire. The quicker you put it out, the less damage there is.
Makes sense. So you got to be fast, right? But in an emergency, it's chaos. How do you know what to do first?
Well, that's where the core principles of emergency management come in. They call them the ABCDs: airway, breathing, circulation, and disability. It's how we go through things quickly to make sure the patient is stable.
It's like a checklist for when things are crazy. Okay, so now the patient's stable, but the danger's not gone, right? What about those emergency drugs, the antidotes? What do they do then?
Emergency drugs, they're kind of the big guns in medicine. Not your everyday stuff. These are powerful, designed for really serious problems. Control the symptoms, save lives. That's the goal.
Like a whole armory against, I don't know, disease and stuff.
Exactly. And each one, it's got its own thing, its own use. So knowing them, that's key to giving the right care.
This is where it gets really interesting. We'll be looking at the heart today. That thing keeps us going, right? We'll be talking about when things go wrong there and how emergency drugs can turn things around.
The heart's an amazing organ, but it can have all sorts of problems, like coronary pain syndromes. These happen when there's less blood flowing in the coronary arteries. Those are the blood vessels that feed the heart itself.
So like the heart's not getting enough gas to run.
Yeah, exactly. And that's when we see things like angina. You've got stable angina and unstable angina. Stable angina usually happens when you're active or stressed. But unstable angina, that can happen even when you're just chilling. And it could mean a heart attack's coming.
Wow, so unstable angina is like a ticking time bomb. So what do you do if someone has angina?
Well, for angina pectoris, we often use glyceryl trinitrate. You might know it as GTN. It's a vasodilator. Basically, it relaxes and widens the blood vessels, especially those coronary arteries, helps get the blood flowing back to the heart muscle.
It's like clearing a traffic jam in the heart, getting everything moving again.
Perfect analogy. Now, when it comes to unstable angina, things get more serious. We need to control the pain fast, so we use morphine sulfate for that.
Morphine, huh? That's some strong stuff. Why use it for this?
Morphine, it's really good for visceral pain. That's pain from your organs. It helps with the pain and the anxiety that comes with unstable angina.
Makes sense. Is there anything else you can use? Like if someone can't have morphine?
Oh, yeah, sure. We can use tramadol. It's an opioid, just like morphine. Works a little differently, though, and some people tolerate it better.
Good to know. Speaking of things people know, what about aspirin? They always talk about that for heart stuff. What does it do in an emergency?
Aspirin's a lifesaver when we think someone's having a heart attack. A myocardial infarction, in doctor speak, it stops those platelets from sticking together. If they stick together, they can form a clot and block those coronary arteries.
So it's all about preventing a heart attack. They say time is muscle, right? The quicker you act, the better.
Yeah, absolutely. And there's a trick to make aspirin work faster. You just dilute it in some water before you give it to them. Gets into the blood quicker that way.
Wow. So even little things like that can make a big difference. So what exactly happens during a heart attack?
Well, a heart attack, it happens when a coronary artery gets blocked completely, cuts off blood flow to part of the heart muscle. And without that oxygen-rich blood, well, that part of the heart starts to die.
Like a part of the engine just stops getting fuel. So what do you do in the ER when someone has a heart attack?
Gotta move fast. First, control the pain, so GTN or morphine. But the real game changer is thrombolytic therapy. That's where we use meds to actually dissolve the clot that's causing the blockage.
Like sending in a tow truck to clear up the traffic jam.
Exactly. There are a bunch of different thrombolytic agents, some better than others. We like to use tenecteplase and alteplase. They work fast and don't need a long IV drip.
Faster action. That's what you need with a heart attack. Now, what about cardiac arrest? That's got to be one of the scariest things, right?
It is. Cardiac arrest, it's basically when the heart just stops pumping blood. Usually it's because there's something wrong with the heart's electrical system.
Yeah.
It's life or death. You got to act immediately.
The engine just shuts off. What do you do first when someone's in cardiac arrest?
Defibrillation. You've probably seen it, those paddles on the chest. It's like hitting the reset button on the heart's electrical system, trying to get it back to a normal rhythm.
Like jump-starting the heart. Okay, but what about meds? Do you use those too?
Yeah, adrenaline is the main one. It's a hormone, and it does two really important things. It tightens those blood vessels, which helps push blood to the vital organs, and it makes the heart squeeze harder, gives it an extra boost.
So it's like giving the heart a shot of energy and making sure that energy goes where it's needed.
Exactly. And on top of adrenaline, we might use things like amiodarone or lidocaine. They help control arrhythmias. Those are irregular heartbeats that can make the cardiac arrest worse.
So it's a whole team effort to get that heart back on track. Now let's talk about cardiogenic shock. What even is that? How is it different from cardiac arrest?
So in cardiogenic shock, the heart's beating, but it's just not pumping enough blood to keep up with the body's needs. It's a problem with the pumping, not the rhythm, which is what you see in cardiac arrest.
So the engine's running, but it's not strong enough.
Exactly. So for cardiogenic shock, we often use dopamine and dobutamine. Both are given through an IV, and they help the heart pump better.
Like giving the heart a tune-up, helping it work better.
That's a good way to think about it. Dopamine, we usually use that when someone has low blood pressure. And dobutamine, we use that when we got to make the heartbeat stronger without messing with the heart rate too much.
It's amazing how these medications can do such specific things. Now, we've talked about angina, heart attacks, cardiac arrest, even cardiogenic shock. What about arrhythmias? Those irregular heartbeats, what kind do you see in the ER?
Arrhythmias, there are a ton of them. So many things can cause them, and they range from totally harmless to, deadly. Let's start with a common one, paroxysmal supraventricular tachycardia, PSVT for short.
PSVT, that's a mouthful. What does that even mean?
PSVT, it's when your heart rate suddenly goes way up, like over 150 beats per minute. There's an abnormal electrical pathway in the heart, and it messes up the normal rhythm.
Like the heart's wiring's gone haywire and it's just racing.
Yeah, good way to put it. So for PSVT, we use adenosine. We give it as a quick injection, and it basically stops the heart for a sec. This can reset that abnormal pathway and get the rhythm back to normal.
Whoa, so you're hitting the pause button on the heart.
Yeah, pretty much. All right, next up, atrial flutter. This one, the atria, the top chambers of the heart, they beat super fast and regular, but only some of those signals get to the ventricles, the bottom chambers. It makes this jagged pattern on the EKG.
Okay, so it's a specific type of messed up rhythm. What do you usually do for that?
We use a combo of meds to get the heart rate under control and restore that normal rhythm. Verapamil and digoxin, those slow down the ventricular rate. Then we use amiodarone to try to get the heart back to its normal sinus rhythm.
So you slow it down, then reset it. What about atrial fibrillation? I hear that one's pretty common.
It is. Atrial fibrillation, AFib, it's like the most common type of irregular heartbeat. With AFib, the atria, they don't beat right. They just kind of like quiver. This can make your heartbeat super irregular and fast, too.
So the atria are having a rave instead of doing their job.
Haha, yeah. And because the blood isn't moving right, it can clot, and then those clots can travel to the brain and cause a stroke. So with AFib, we also got to give meds to prevent stroke, like warfarin.
Stroke prevention, that's big.
Yeah.
So for controlling the rate, do you use the same meds as for atrial flutter?
Yep, same ones. Verapamil, digoxin, and amiodarone, they can all help get the heart rate under control in AFib too.
Okay, so some overlap there. Now, ventricular tachycardia, VT. That sounds scarier because it's the ventricles, right? The main pumping chambers.
You got it. VT, it's when you get 3 or more of these early beats from the ventricles. And the ventricles, they're the powerhouse of the heart. So when their rhythm gets messed up, things can go south real fast.
Sounds like the engine's about to stall. How do you treat VT?
Depends on how bad it is and what's causing it. If it's stable VT, we might use lignocaine or magnesium sulfate. Those can help stabilize the rhythm.
Okay, so those are for the not-so-bad cases. What about when it's really serious, like life-threatening?
There's a specific type of VT called torsades de pointe. It's a super fast and chaotic ventricular rhythm. It's a real emergency, and magnesium sulfate is often the first thing we use.
So magnesium is key for getting things back in order.
Absolutely. Now the worst one, ventricular fibrillation.
That doesn't sound good.
Yeah, it's bad. Ventricular fibrillation, it's pure chaos. The ventricles just quiver instead of contracting properly, is what you usually see in cardiac arrest.
So it's a dire situation. What's the first thing you do?
Just like with other types of cardiac arrest, defibrillation is the most important thing. We got to shock that heart back into a normal rhythm ASAP. We might also use amiodarone to help stabilize the rhythm.
So shocks and meds working together.
Exactly. And one last one, AV block.
AV block, what's that?
AV block, it's when there's a problem with those electrical signals going through the AV node. That's like the electrical gateway between the top and bottom chambers of the heart.
So like a blockage in the heart's wiring?
Yeah, kinda. And depending on how bad the block is, it can slow down the heart rate or even cause complete heart block. That's when the atria and ventricles beat totally separately.
That sounds dangerous. How do you treat it?
If it's caused by something called vagal overactivity, that's when the vagus nerve stimulates and slows down the heart. Atropine can be really helpful. And for partial AV block, we might use adrenaline or isoprenaline to help maintain the heart's output.
So different treatments for different types of block. Now, what about hypertensive emergencies? What makes those so dangerous?
It's not just about high blood pressure. It's when that high blood pressure starts damaging your organs. We're talking strokes, heart attacks, kidney failure, even death. It's serious.
So it's not just the numbers, it's what it's doing to your body.
Right. We got to get that blood pressure down fast, but safely.
What's the go-to med for that?
Sodium nitroprusside. Strong vasodilator. We can adjust it carefully to bring that blood pressure down quickly and effectively. Got to be careful, though. High doses can be toxic. Monitoring is super important.
So it's powerful, but you got to use it carefully. Any other options for hypertensive emergencies?
We can use GTN or esmolol, and if we can't get an IV in quickly, we might use nifedipine capsules under the tongue or swallowed. And for certain situations like pheochromocytoma, cheese reactions, or if someone suddenly stops taking clonidine, we often use phentolamine or labetalol. Oh, and for high blood pressure during pregnancy, labetalol is usually the best choice.
So many choices. It's clear that each situation needs a different approach.
Absolutely. Got to know how those drugs work and when to use them. That's crucial in emergency medicine.
We've spent a lot of time on cardiovascular emergencies, and wow, I've learned a lot. But we got to talk about another critical area, respiratory emergencies. Stick with us as we dive deep into those situations when, breathing gets tough.
Yeah, when someone can't breathe, every second counts. And just like with heart problems, we've got a whole bunch of emergency drugs that can really make a difference.
So let's start with a common one, asthma. What do you do when someone's having a bad asthma attack?
In an asthma attack, the airways get all tight, makes it hard to breathe. We got to open those airways up fast. So we usually use a mix of salbutamol and ipratropium bromide. We give it through a nebulizer. It turns the meds into a fine mist that they can breathe in.
So you're getting those meds right where they're needed. How do those drugs actually work to help someone breathe easier?
So salbutamol is what we call a beta-2 agonist. It relaxes the muscles in the airways, lets them open up. Ipratropium bromide, that's an anticholinergic. It blocks this neurotransmitter, acetylcholine, which can cause bronchospasm. Basically, it stops the airways from tightening up.
So they're working in different ways, but both aiming to get those airways open. I've also heard about corticosteroids being used for asthma.
You're right. For severe attacks, we can give corticosteroids like hydrocortisone through an IV. They work by reducing inflammation in the airways, which is a big part of what makes asthma so hard to breathe with.
So you're calming down those irritated airways. What about aminophylline? Have you ever used that for asthma?
Yeah, aminophylline is another bronchodilator, opens up those airways. We usually give it through an IV, but gotta do it slowly to avoid any bad side effects.
Slow and steady wins the race, huh? We've talked a lot about asthma. What about COPD? I know that can cause emergencies too.
Right. COPD stands for chronic obstructive pulmonary disease. It's a lung disease that gets worse over time, makes it hard to breathe, and when things suddenly get worse, that's called a COPD exacerbation.
Like a sudden flare-up of those breathing problems. How do you handle that in the ER?
The good news is a lot of the meds we use for asthma attacks also work for COPD exacerbations. So salbutamol, ipratropium bromide, hydrocortisone, aminophylline, those can all help.
So same idea, open up those airways and get the inflammation under control. Now, let's talk about a scary one, epiglottitis.
Epiglottitis is when the epiglottis gets inflamed. That's the little flap that covers your windpipe when you swallow so food and drinks don't go down the wrong way. But when it's inflamed, it can block your airway and you can't breathe.
That sounds terrifying. What causes that and how do you treat it?
Usually a bacterial infection. Got to hit it with antibiotics fast. Ceftriaxone is our go-to. gets that infection under control, and reduces the swelling. This is a real emergency. We got to act quickly to secure the airway.
Every second counts. What about pulmonary edema? That sounds pretty serious, too.
Pulmonary edema, that's when fluid builds up in the lungs, makes it hard to breathe. Imagine your lungs filling up with water. That's basically what's happening.
Okay, that image is not great. What causes it, and what do you do about it?
It can be caused by a bunch of different things, like heart failure, kidney failure, even altitude sickness. Treatment depends on the cause, but it usually involves giving them oxygen, diuretics to get rid of the excess fluid, and maybe some meds to help the heart.
So get the fluid out of the lungs and figure out what's causing it to build up in the first place. What kind of diuretic do you usually use for that?
Furosemide. It's a really good diuretic, and we give it through an IV. Works fast to get rid of that fluid, and the cool thing about furosemide is not only does it get rid of fluid, it's also a vasodilator. It opens up those blood vessels, helps improve blood flow, and takes some pressure off the heart.
2 birds, 1 stone. What other meds might you use for pulmonary edema?
Sometimes we'll use intravenous nitroglycerin, helps dilate the blood vessels and reduce pressure in the lungs. And if it's caused by heart failure, we might give dopamine or dobutamine to support the heart. Oh, and sometimes we use morphine to help with the anxiety and dyspnea. That's the shortness of breath.
So it's like a whole team of meds working together to fix this problem.
Exactly. All right, enough about breathing problems. Let's talk about the most complicated organ in the body, the brain.
The brain, the control center for everything. What happens when things go wrong up there?
Neurological emergencies, they involve the brain, the spinal cord, the nerves. And just like with the heart and lungs, when things go wrong, it can be life or death.
Let's start with one everyone knows, seizures. What exactly is a seizure?
Think of it like an electrical storm in the brain, sudden surge of electrical activity. Can cause all sorts of symptoms, from convulsions and passing out to like subtle changes in behavior or how you feel things.
Sounds pretty intense. What do you do when someone's having a seizure?
First thing, make sure they're safe. Got to protect them from injury during the seizure. If it lasts too long or keeps happening, that's when we might give meds like midazolam or diazepam to stop it.
Those sound familiar. Are those like the meds they use for anxiety?
Yeah, they're in the same family, benzodiazepines. They work by calming down all that electrical activity in the brain.
Makes sense. What about status epilepticus? I've heard that's really bad.
Yeah, status epilepticus is serious. It's
Yeah.
when a seizure lasts for more than 5 minutes or when someone keeps having seizures without waking up in between. It's an emergency and we got to treat it aggressively.
So you got to bring out the big guns, medication-wise.
We might use a bunch of different meds. The benzodiazepines we talked about, other anticonvulsants like phenytoin, phenobarbital, even general anesthesia if we have to. The goal is to stop those seizures fast before there's permanent brain damage.
It's a tough balance, controlling the seizures, but also protecting the brain. Now, tetanus, I've always been kind of scared of that one.
Tetanus or lockjaw, it's a bacterial infection that messes with your nervous system. Causes painful muscle spasms.
I remember getting a tetanus shot when I was a kid, but I always thought it was from rusty nails. Is that true?
Not really. Rusty metal can have the bacteria, but any deep cut or puncture wound is a risk if those bacteria get in. The important thing is to keep your tetanus shots up to date.
Good to know. So if someone does get infected, how do you treat tetanus?
3 things. First, tetanus immune globulin. It's got antibodies that neutralize the toxin. Second, antibiotics to kill those bacteria. And third, just supportive care. Manage the muscle spasms and other symptoms.
So neutralize the toxin, kill the bacteria, and make them comfortable. Now, what about meningitis? That's another infection that can affect the brain, right?
Meningitis is inflammation of the meninges, the membranes around the brain and spinal cord. Bacteria, viruses, other microorganisms, they can all cause it.
But bacterial meningitis, that's the one you really got to worry about, right?
Exactly. Bacterial meningitis is a real emergency. It can get bad fast, lead to brain damage, even death. We got to start antibiotics ASAP.
So another race against time. How do you choose the right antibiotics?
At first, we often use what we call empirical therapy. Basically, we choose antibiotics that are likely to work based on what we think it is, even before we know for sure. We use broad-spectrum antibiotics, the ones that can kill a lot of different bacteria.
So a wide net until you know what you're dealing with. What about once you have a diagnosis?
Once we know exactly what bacteria is causing it, then we can fine-tune the antibiotics. Different bacteria respond to different antibiotics, so gotta pick the right ones.
Makes sense. Seizures, tetanus, meningitis, any other neurological emergencies we should know about?
Tons, but one more we should talk about. Guillain-Barré syndrome. Ever heard of that?
Guillain-Barré syndrome. Maybe. I'm not sure. Refresh my memory.
It's rare, but it's serious. The body's immune system attacks the peripheral nerves, can cause weakness, paralysis, even problems breathing.
So the immune system's attacking the body's own nerves.
Yeah, and it can progress quickly. Got to recognize the symptoms and get help right away.
What are the symptoms and how do you treat it?
Starts with weakness and tingling in the legs and feet, can spread to the arms and upper body. Severe cases, it can even affect the muscles you need to breathe. Treatments is supportive care, might need a ventilator if breathing is bad. And we use therapies that suppress the immune system like intravenous immunoglobulin or plasma exchange.
Sounds like a complicated condition to manage.
It is. But the good news is most people with Guillain-Barré syndrome do recover eventually. It can take time in rehab, though.
So there's hope, but got to catch it and treat it early.
Absolutely. All right, let's move on from the brain and talk about hormones. Endocrine emergencies.
Endocrine emergencies. So that's when the hormones go haywire.
You got it. Hormones, they're chemical messengers, control all sorts of things in the body. Metabolism, growth, mood, sleep, you name it.
So endocrine emergencies, that's when those systems get messed up.
Exactly. And those imbalances, they can cause a whole bunch of problems, some of them life-threatening.
Okay, lay it on me. Let's start with one that's a big deal for people with diabetes. Diabetic ketoacidosis, or DKA.
DKA, it's a serious complication of diabetes. Happens when there's not enough insulin to process glucose, the sugar our cells use for energy.
Insulin's like the key that lets the sugar into the cells, right?
Right. No insulin, no sugar in the cells. So the body starts breaking down fat for fuel instead, and that produces ketones, which are acidic. They build up in the blood, and that's ketoacidosis.
It's like the body's running on fumes, and those fumes are toxic. What are the symptoms, and how do you treat it?
You get really thirsty, pee a lot, nauseous, vomiting, abdominal pain, and your breath smells fruity. That's the ketones. Treatment is IV fluids to rehydrate, insulin to lower the blood sugar, and electrolytes to get everything back in balance.
So fluids, insulin, and electrolytes.
Yeah.
What about hyperosmolar, hyperglycemic state, or HHS? Is that different from DKA?
HHS is similar, really high blood sugar, but it usually happens in people with type 2 diabetes, and it's not as common as DKA. With HHS, the blood sugar gets so high, it starts sucking the water out of your tissues. Dehydration gets really bad.
Like a sugar sponge, soaking up all the moisture.
Yeah, good analogy. And like DKA, we treat it with fluids, insulin, and electrolyte correction.
Same principles. All right, let's talk about the adrenal gland. What happens when that goes wrong?
The adrenal glands, they make a bunch of important hormones like cortisol. Cortisol, it's all about stress response, blood sugar, blood pressure. Adrenal insufficiency is when the adrenal glands don't make enough cortisol.
So the body's stress response system isn't working right.
Yeah, and that can lead to adrenal crisis, life-threatening, low blood pressure, low blood sugar, electrolyte imbalances.
Sounds like a whole system crash.
Yeah.
What's the treatment?
IV fluids and corticosteroids, like hydrocortisone. Replace that missing cortisol.
So you're giving the body what it's not making on its own. Now let's switch to the opposite of high blood sugar. Hypoglycemia.
Hypoglycemia, low blood sugar, it's when your blood sugar drops too low. Not enough energy for the brain and body. Anyone can get it, but it's most common in people with diabetes who take insulin or other meds that lower blood sugar.
Man, it can be dangerous, right?
Very dangerous. Confusion, seizures, passing out, even coma.
So, got to recognize those symptoms and act fast. What do you do for hypoglycemia?
If they're awake and can swallow, give them something sugary. Juice, glucose tablets, something like that. Get that blood sugar up quickly.
Seems easy enough. What if they're unconscious?
Unconscious, can't swallow, that's a medical emergency. In the hospital, we give them IV glucose, gets the blood sugar up fast.
Get that sugar in there one way or another. All right, let's talk thyroid. What happens when that gland acts up?
The thyroid, it's all about metabolism, growth, development. When it's overactive, that's hyperthyroidism.
Hyperthyroidism, that's when your metabolism goes into overdrive, right?
Yep. Weight loss, racing heart, sweating, anxiety.
I can see how that could be an emergency.
It definitely can, especially if it turns into thyroid storm. Super fast heart rate, high fever, mental status changes. It's life-threatening.
So how do you treat that?
Thyroid storm, it's a multi-pronged approach. Meds to slow the heart, block thyroid hormone production, manage the symptoms. And we do supportive care, IV fluids, cooling measures, anything to stabilize the patient.
Calm down that thyroid. Support the body while it recovers. What about the opposite, hypothyroidism?
Hypothyroidism, that's when the thyroid's underactive. Not enough thyroid hormone. Fatigue, weight gain, cold intolerance, depression.
Like the metabolism's running in slow motion.
Exactly. And in severe cases, you can get mixed edema coma, mental function slows down, body temp drops, breathing gets difficult.
So just like thyroid storm, it can go from a chronic condition to an emergency really fast.
That's right. And like a lot of endocrine emergencies, we got to treat the underlying hormone problem and provide supportive care to stabilize the patient.
A delicate balance, replacing what's missing and dealing with any life-threatening complications. So we've talked about a lot of different endocrine emergencies. Is there a common theme here?
I think the big thing is that hormone imbalances can really mess with your body. Got to know the signs and symptoms so you can get treatment quickly.
Well said. Well, that wraps up our discussion on endocrine emergencies. But stick with us, because next up, we're talking antidotes. I'm always fascinated by the idea that there's a specific antidote, a magic bullet, for so many different poisons.
It's pretty amazing, right? Antidotes are like special keys that unlock the poison's grip on the body. They're not always perfect, but they can be incredibly effective at reversing those effects and saving lives.
All right, let's talk antidotes. Start with a class of drugs I know can be really dangerous in overdoses. Opiates.
Opiates, things like heroin, morphine, fentanyl, they're strong pain relievers, but overdose is a real danger. The main problem is they suppress the respiratory system. Slow breathing, respiratory arrest, death.
It's like they put the brakes on breathing. So what's the antidote for opiate overdose?
Naloxone, you might know it as Narcan. It blocks the effects of opiates on the brain, reverses that respiratory depression, brings people back from the brink of death.
Now that's a lifesaver. How do you give naloxone?
4, intramuscular injection, even in nasal spray. And it works fast, usually within minutes.
Amazing how quickly it can turn things around. Now, what about another common over-the-counter med that can be dangerous in overdose? Paracetamol.
Paracetamol, or acetaminophen, it's a good pain reliever when you take it as directed. But overdose can really damage your liver.
It's all about the dose. What happens when someone takes too much paracetamol?
The liver processes it, and when there's too much, it makes this toxic byproduct that can hurt liver cells.
The liver's detox system gets overloaded.
Yeah.
So what's the antidote?
N-acetylcysteine, or NAC. It helps replenish glutathione in the liver, and glutathione is essential for getting rid of that toxic paracetamol byproduct.
So you're giving the liver a boost to clean up the mess.
Exactly. And the sooner you give NAC after a paracetamol overdose, the better it works at preventing liver damage.
Time is liver. Now, organophosphates, not even sure what those are.
They're chemicals found in some pesticides and insecticides. They mess with a neurotransmitter called acetylcholine, which is super important for your nerves to work properly.
So they disrupt the communication system in the nervous system.
Right. And that can cause all sorts of problems. Muscle weakness, breathing problems, seizures, even coma.
A full body attack. Is there an antidote?
For organophosphates, we use atropine and pralidoxime. Atropine blocks the effects of acetylcholine, and pralidoxime reactivates the enzyme that's been messed up by the organophosphates.
Block the bad stuff,
Yeah.
reactivate the good stuff.
Exactly. All right, let's move on to one that's always in the movies, cyanide poisoning.
Cyanide. Spies and murder mysteries. How does that even work?
Cyanide, it's fast-acting. It interferes with cellular respiration. That's how your cells use oxygen to make energy. It basically suffocates them.
A cellular attack. That's scary stuff. Is there an antidote?
There are a few. One is a combo of sodium nitrite and sodium thiosulfate. Another is hydroxycobalamin, a type of vitamin B12.
So different ways to fight off that poison.
Huh.
Okay, what about oral anticoagulants? Those are blood thinners, right?
Yeah, like warfarin. Prevent blood clots, often prescribed for people at risk for stroke or heart attack. But, like a lot of meds, too much is a bad thing.
So too much blood thinner and you bleed too easily.
Exactly. Overdose on those, you can have serious bleeding problems.
What's the antidote for that?
Vitamin K. It helps reverse the effects of the blood thinner and gets things back to normal.
Puts the brakes on the blood thinning. Okay, beta-adrenergic antagonists. Those are beta blockers, right? For high blood pressure and heart problems.
Yeah, they block the effects of adrenaline on the heart. Slow down the heart rate, lower blood pressure, reduce the workload on the heart. But overdoses can cause a really slow heart rate, low blood pressure, even heart failure.
Finding that balance is important. What do you do if someone overdoses on beta blockers?
Glucagon. It's a hormone, and it helps to speed up the heart and raise blood pressure.
Counteracts those slowing down effects. Okay, iron poisoning.
Yeah.
That's one I worry about with kids.
Iron, it's a mineral we need, but too much can be toxic. Kids accidentally getting into iron supplements, that's usually how it happens.
So something that's good for us can be dangerous in excess. What happens with iron poisoning?
Iron is corrosive. It can damage the stomach and intestines, messes with blood clotting, can even damage organs like the liver, kidneys, and heart.
Sounds like a systemic attack. What's the antidote?
Deferoxamine. Binds to iron, helps get rid of it.
Like a magnet for iron pulls it out of the blood.
Exactly. And the sooner you give it after an overdose, the better. Less chance of serious problems.
So early treatment is key. Now, what about digoxin? That's a heart medication, right? But I've heard it can be toxic too.
It is. Digoxin helps the heart beat stronger, but it's got what we call a narrow therapeutic index. That means the dose that works is close to the dose that's toxic.
A powerful drug. Got to be careful with that one. What happens in digoxin overdose?
All sorts of symptoms. Nausea, vomiting, confusion, vision problems, irregular heartbeats.
Affects a lot of different things. Is there an antidote?
Depends on the symptoms. We might use atropine or digoxin immune fab. Those are antibodies that bind to digoxin and help get it out of the body. We might also just do supportive care, IV fluids, meds to stabilize the heart rhythm, things like that.
So specific treatments plus general support.
Yep. Now let's talk about methanol.
Methanol, isn't that the one that can make you go blind?
You got it. Toxic alcohol. Sometimes found in antifreeze, other industrial products. Really dangerous to drink, even a little bit.
So what happens if someone drinks methanol?
The liver breaks it down into toxic substances. Those can damage the optic nerve. That's what causes blindness. You can also get severe metabolic acidosis, coma, death.
Another systemic attack. Any antidote for that one?
Believe it or not, it's ethanol. Regular drinking alcohol. Sounds weird using one alcohol to treat another, but ethanol competes with methanol for those same enzymes in the liver. Slows down the production of those toxic byproducts.
It's like a race, and ethanol wins, keeps those toxic substances from forming.
Exactly. We can also use fomepizole, which blocks those enzymes too.
So a couple options for that one.
Right. And I think that covers the major antidotes for the most common and dangerous poisonings.
Wow, we've covered so much today. Heart attacks, seizures, all those antidotes.
It's been a whirlwind tour of emergency medicine for sure.
And I feel like, I don't know, a little more prepared now. I could actually maybe do something.
That's what we want. Knowing what to do, that's half the battle.
Absolutely. So before we wrap things up, let's go back to the golden hour. That idea that in an emergency, time is everything.
It really is. That first hour after an injury or a medical crisis, it's crucial. That's when getting the right treatment makes the biggest difference.
Like they say, time is muscle with heart attacks. But it's true for so many other emergencies too.
Yeah, the faster we can figure out what's wrong and start treating it, the better the outcome.
So what are the key things our listeners should remember about the golden hour?
Well, first, recognize the signs of an emergency. Chest pain, trouble breathing, bleeding a lot, unconsciousness. Those are all serious. You got to get help right away.
Don't wait. Call for help. It's better to be safe than sorry.
Exactly. And while you're waiting, there are things you can do to help. Remember the ABCDs: airway, breathing, circulation, and disability.
That checklist for when things are crazy.
Yeah, that's it. Make sure their airway's open, they're breathing, they have a pulse, check how alert they are. Those basic things can make a huge difference.
And don't forget first aid. Even simple things like applying pressure to stop bleeding, keeping them warm, and just staying calm, those can help a lot.
Absolutely. Basic first aid, it can save lives.
This has been such an amazing deep dive into emergency medicine. I feel like I've learned so much about how to spot an emergency and what to do.
Glad to hear it. It's been great talking with you.
And before we go, one last thank you to London HeartbeatsZ Academy over in the UK. They gave us all this amazing material for this deep dive.
They're doing incredible work, making this kind of information available to everyone.
If you want to learn more from London HeartbeatsZ Academy, go check out their social media. Facebook, Instagram, Spotify, YouTube. They're everywhere. They're always posting new stuff, so follow them to stay up to date. And to all our listeners, thanks for joining us on this deep dive into emergency medicine. We hope you learned something and maybe feel a little more prepared for those moments when every second counts. Stay safe out there.